The Minister for Health and Medical Services, Honorable Dr. Efraim Monganabete, the World Health Organization representative to South Pacific, Director and Technical Support, Dr. Mark Jacob, the Permanent Secretary for Health and Medical Services, James Fong, and invited Permanent Secretaries, representatives from the World Bank, ladies and gentlemen, and members of the media. It's a good day today, and good morning to you all. It gives me great pleasure to be invited to officiate at this Healthy Setting Launch Initiative. I acknowledge the joint effort and commitment of the Ministry of Health and Medical Services in collaboration with the World Health Organization and the World Bank for the immense contributions to this awareness platform and this important event. It is clearly evident that old, new, and emerging challenges with health and healthy settings continue nationally, regionally, and globally, and it has now become crucial for our collective effort to carry out awareness and immediate action. Ladies and gentlemen, in the Pacific, especially in Fiji, non-communicable disease, NCD, is a leading cause of premature death and disability, and it has caused an alarming rate of death each year and continues at a staggering rate. In Fiji, over 80% of our mortality is attributed to NCDs and NCD-related illnesses. Our risk factor for NCD remains crucial for immediate and collective interventions at all levels. Heart disease and diabetes remain the largest contributor to Fiji's mortality statistics. The effects of NCDs is not isolated to the health sector alone. The premature deaths and with disability caused by NCDs equally place a greater burden to the economy. The 2018 Economic Burden Report Fiji, commissioned by the UNDP and the World Health Organization, Western Pacific Region Organization, they reported an estimated $406 million is a total economic burden due to NCDs to the Fijian society. The report adopted a societal perspective that assumes that all costs are taken into account irrespective of who incur these costs. These costs included direct cost of health care, cost of lost productivity arising from people leaving the workforce due to premature deaths, being absent from work or not being fully productive at work due to illness, as well as carers lost productivity due to leaving the workforce to care for a person with NCD. Ladies and gentlemen, we can sit and run the numbers all day on the burden NCD imposes on our national mortality, economy, productivity, and development. The fact remains that NCD continues to threaten our national health and sustainability. The need to act is now. Fiji is fortunate that our government, through the Ministry of Health and Medical Services, is cognizant of the risk factors contributing to the NCDs and liability that NCDs incur. The prevalence of NCDs-related challenges in our country and the coronavirus pandemic has revealed to us the need for multi-sectoral action with clarity of purpose and broad, innovative sectoral-based approaches to combating these challenges. Multi-sectoral action is essential in the context of interconnections between three very essential sustainable development dimensions that are economically, societal, and environmental. The result of multi-sectional action response to NCD is healthy islands and settings approach. The World Health Organization defines settings-based approach to health promotion as those that involve a holistic and multidisciplinary method which integrates action across risk factors. The goal is to maximize disease prevention via a whole system approach. The healthy settings movement has roots in the World Health Organization's Health for All strategy of 1980 with specifically the Ottawa Charter for Health Promotion. Healthy settings, key principles include community participation, partnership, empowerment, and equity. According to the World Health Organization, a setting for health is a social context in which people engage in daily activities where environmental, organizational, and personal factors interact to possibly affect their health and well-being. In Fiji, our healthy settings include schools, communities, villages, faith-based organizations, towns, cities, and workplaces, and our focus needs to be holistic. Simple examples of holistic healthy settings include having gardens where healthy organic foods are planted and consumed. Gardening in its own right is a form of exercise. Our people need to have access to water, sanitation, and hygiene. That basically means access to clean, safe, and hygienic water with clean and safe laboratories for all healthy settings. Even employees in the workforce should be encouraged to engage in physical wellness activities and consumption of healthy, organic, and balanced diets. In fact, this should be encouraged for all Fijians to help promote the collective consciousness around mental health and protecting the environment, our ocean, seas, and rivers by practicing the 4 R's, waste management: reduce, reuse, recycle, and rethink. Settings for health can promote a healthy nation as they are vehicles to reach individuals to gain access to services and collaboratively bring together interactions through the wider community. The launch of this Healthy Settings program is our country's advent into the sector-wide approaches to tackle NCD. It is one of the prongs of the multi-pronged approaches that the Ministry of Health and Medical Services has adopted to ensure wellness, NCD prevention, and control action across the lifespan of its holistic eradication efforts. Ladies and gentlemen, at this juncture, with the Ministry of Health and Medical Services, I call on workplaces, schools, communities to adopt a healthier workplace to approach decrease mortality rates as well as ensure a productive and healthy working population contributing to an economically sound nation. I can proudly share that my staff at the Office of the President religiously observed Wednesday Wellness, our program, and the results have been rewarding. With that, I wish to officially announce the launch of the Ministry of Health and Medical Services Healthy Settings. And may God bless Fiji.
Mm-hmm.